Welcome back. Globally, we've now surpassed 325 million COVID cases as the Omicron variant spreads like wildfire. The good news, if any, is that this particular strain seems to produce less severe cases than previous variants. And earlier this month, a CDC advisory panel recommended booster shots for teens ages 12 to 17, expanding our pandemic war chest. Joining us now to talk all about COVID and the Biden administration as they prepare to deliver 500 million free at-home tests is Dr. Raj Dasgupta, pulmonary and critical care specialist at Keck School of Medicine at USC. Dr. Raj, thanks for being here.
Oh, thank you very much for having me today.
So now that we've passed the 300 million mark, do you think we've reached the peak of Omicron and it will now start to settle and go down as we saw in South Africa? Is this the beginning of the end, as so many hope?
Well, I always want to be a positive person, but the truth is that I look at my friends, colleagues around the country, around the world, and they're just swamped in the medical ICU. And they are to capacity when we talk about hospital beds and ICU beds. But yes, I heard the same thing you've heard recently, which is on the East Coast of our country, that where the Omicron variant first started, things are going slowly in the right direction. So hopefully this is going to carry over to the West Coast and everywhere else to help us. But I want to spend time and talk about one thing, which is why does everyone think that, well, if Omicron variant is not as transmissive, it's not as severe, why are ICU beds and hospital beds actually to capacity? And the answer is it's always talking about percent. And so even though we say that the percent of people going to the ICU is not as bad, think about this. If we pick some random numbers, like let's say with Delta variant, there's 100 patients out there and 10% end up in the ICU, that's going to be, 10 beds. But now we talk about Omicron and we know how contagious it is. So now it's 500. And what's 5% of 500 is 25, double the amount of beds that we need. And most ICUs don't even have 25 beds, nor are they all dedicated to Omicron variant. So combine that with shortages and staffing because people are isolated and in quarantine. This is why I just hope and pray that we do go in the right direction when we talk about coronavirus in general.
Yeah, it's a numbers game at this point, is what I hear you saying. So we know this is one of the most contagious viruses on Earth, this particular variant. What is your guidance when it comes to masks? Are cloth masks no longer effective against COVID?
So this is the hottest topic right now. So we're really talking about prevention. So there's only two ways to prevent getting infected. One is get that vaccine and get the booster if you're a candidate. And the other is the big three: good hand hygiene, social distancing, wearing the mask, and wear it correctly. So when we talk about masks, I divide it into three main types of masks. On one side, there's that cloth mask. And we know now, based upon science, it's not the mask you want to protect yourself or to protect others. It's kind of like a single layer mask. It doesn't fit that well. On the other side, we have the gold standard, which is the N95 mask or its equivalents, like the KN95 mask. And when we talk about that mask, especially the N95 that we use here in the United States, is that, it's mainly fitted for healthcare professionals like myself, so it fits really well. And, if you are using an N95, don't use that one-way valve on the front. Why? Because it definitely will protect yourself, but not others, because you could blow out the air. Then on top of that, when we talk about wearing an N95 all day, it's just not the easiest thing to do. Then in between, the last mask is kind of like a surgical mask like this. And each hospital has different grades of surgical masks. So it really depends what the hospital is. So bottom line point is this: people ask me, what mask do you wear? Well, it kind of is the one you're going to wear all day. But of course, the gold standard is the N95. It's not bad to double mask with a surgical and a cloth mask. But realize, who are you around? Are you vaccinated or not? Are you indoor or not? All these things is going to contribute to what mask I pick. Protect yourself and others.
Got it. Okay, what about the CDC shortening these isolation guidelines from 10 days to 5 days? Is it actually advisable to you as a healthcare professional, or is this an attempt to defray the economic impact in the U.S.? And is it advisable to return to work even if you haven't tested negative first, because we know it can take weeks to test negative?
Now, really, now that is a question. So, I think it really comes down to messaging, and when we talk about messaging nowadays, this last couple of weeks to month, it is a little bit confusing because is it quarantine or is it isolation? What are we talking about? What about the incubation period? So right now, when we talk about isolating, that means if you tested positive, that the CDC states that you can break isolation at 5 days and then wear a mask for another 5 days for a total of 10. But people have been asking me, but the incubation period, which is by the time you're infected till you show symptoms, when we first started the pandemic was around 14 days. So at day number 5, I do understand why they say you could break isolation, because of the fact that Omicron variant, when you get the symptoms, it's really much sooner. So by the time it's day number 5, the viral load isn't as bad, you're not as infected, but it's not zero. And that's raised some controversy about breaking at day 5. And then they said, well, hey, just go get tested. But you know what? It's not easy to get these tests. And if you do find one, you probably can't even afford it to begin with. And then you wear a mask for another 5 days. But why just only 5 days? Now, you should be wearing it for pretty much longer. So I think that's where they said if you do get tested, if it's a positive test, you just win yourself another 5 days of isolation. If it's negative, definitely wear a mask. And like you asked me earlier, I would suggest something like an N95 mask, but once again, to protect yourself and others. And it's just tough. You know what I mean? I think the messaging is always going to be very complicated. And even for me, when my patient asks me, do I understand the guidelines? I kind of say it's pretty tough. It's not that easy.
The messaging has been confusing, and it seems to be ever changing. But as you mentioned, testing seems to be at least part of the real problem, since so many people are asymptomatic. But as you mentioned, tests are so hard to come by. Do you think when people can actually get these at-home tests from the government that have been promised, things will turn around with the pandemic?
Oh, yes. I think that's why so many people have been frustrated, patients and healthcare providers, because we knew from the beginning of this pandemic, having testing available, good testing available, is really going to guide contact tracing. It's going to guide all these different guidelines that we're talking about now, and being so far into it. And it's a little sad. It's been almost like 2.5, 3 years being into it, still getting that testing. So I think about 2 Qs, the quantity of tests and the quality of tests. So of course, there's the quantity right now. Trying to get one is tough, and it is not cheap to get one to begin with. But quality means that, hey, there was a question of that. I don't mind if you have a few false positives. What's the downside? You isolate, you quarantine, you protect yourself and others, but it's those false negatives that was questioning in the beginning. People asking, hey, can these tests really detect Omicron variant? CDC mentioned that, hey, maybe in the first day, these tests may not be as good in the early side. And that's why you always have to err on the side of being cautious. And of course, the gold standard test is the PCR, looking for the RNA of that virus. And you know what? If you need to do it, you need to do it.
And hopefully it comes back in a reasonable amount of time. Before I let you go,
Yes.
I want to ask you about these African soccer players. 3 of them recently diagnosed with COVID, and now they're all dealing with heart problems as a result. We've known that COVID can cause heart complications, but this is kind of giving it a bigger spotlight. What do we know about COVID and the heart and the long-term effects?
Oh, this may be my favorite question all day. So I always teach my medical students, COVID is not a disease only of the lung. It affects every single organ in the body. And when we talk about the heart, both acutely and chronically, it does 3 things, Rita Bay. Number 1, it can cause arrhythmias, which are unwanted heartbeats. In the atria, it can cause atrial fibrillation or flutter. In the ventricles, it can cause ventricular tachycardia. Number 2, it causes inflammation of every part of the heart, around the sac of the heart called the pericardium, causing pericarditis, or in the muscle of the heart called the myocardium, causing myocarditis that can lead to heart failure. And the last thing that it can do is, remember, COVID infection loves to clot anywhere in the body, artery and vein. And our heart is fed by these blood vessels called the coronary arteries. So you can get a heart attack even as a long hauler. So when I hear heart and COVID, I'm not surprised at all. And of course, I wish all the best to these soccer players. I hope they feel better soon and go back and score a bunch of goals for their team.
We all hope that. Dr. Raj, thank you so much for clearing up so many questions for us. We appreciate it.
You're welcome.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.